Hi friends, welcome back to the channel. Today we are diving into microneedling and I have a demonstration for you at the end. So I microneedled my face and neck yesterday. I was able to record the whole thing, so I'm gonna edit and post it at the end of this video. So we are answering questions like, is a microneedling worth the hype? Is it safe for brown skin? So let's break it all down. Hi, my name is Dr. Sophia Kiran. I'm a clinical lab scientist by training with 20 plus years experience in cell and gene therapy. And my passion is to help women navigate perimenopause using science-backed solutions and self-advocacy. So what is microneedling? So microneedling is called collagen induction therapy, and that is because you're creating a controlled injury in your epidermis, dermis, depending on the depth of the penetration of the needles. So that controlled injury starts a series of biochemical reaction. So that is your body's healing response, and that response stimulates collagen and elastin production. That helps with the fine lines, scars, acne scars, especially radiance and uneven textures. My personal favorites is the radiance. There is this glow up happen 2 weeks after doing the micro needling session, and it's just beautiful. It's like chef's kiss. So once you know how your skin is reacting to microneedling and you have all the basics down, actually you can plan microneedling around certain events and do it 2 weeks before that event, and your skin will be glowing. So after age of 25, we lose 1% of collagen every year. And during perimenopause, the loss is around 3 to 5%. So there is plenty of studies showing efficacy of the procedures, with some studies showing up to 400% increase in collagen and elastin production within 6 months of procedure, which is just amazing. I think if this is something that you find that is working for you, um, I believe it's one of the best things that you can do for yourself and for your skin. Um, I am so glad that I got over that initial fear. That of course, if you know you're talking about poking your face with needles, but all the research and a lot of amazing ladies or the YouTube kind of convinced me to at least go to a specialist and talk to them about it. Even though my skin is very acne and pigmentation prone, and I also have a keloid prone skin, and fortunately that's only my back, and that's something's genetic, so there's nothing I can do about it. But there's always a chance that whenever you're creating an injury, that injury can cause hyperpigmentation, and then God forbid can develop in a keloid. So thank God, that's the problem that I only have in my back, but everything else heals nice, and I can tell that microneedling, consistent microneedling, have made a huge difference in the quality of my skin, and that including the texture, the tone, the radiance, and of course the acne scars. Now let's talk about the safety aspect of this procedure. So when you are doing this at home, safety largely depends on the user. It is very important to make sure that you are disinfecting your devices and supplies, and you're not touching the dirty surface, and then touching your clean items. I think it's just simply a matter of training, and it's not that hard to accomplish. So you just have to create a system where you clean everything. Your working area is all disinfected, clean. This is your like a sterile field, and you wipe down all your devices, including your pen, a dermal roller. If you're using any serums, you wipe that bottle down. So everything get wiped down, and that's your sterile working area. So if you go outside it, if you touch anything, even like if you open a faucet, it means you went outside your working area, and now you have to wash your hands before you come back in and start touching your clean supply. So it's just developing the system. It's very easy to do. It's nothing hard. One thing that I want to make sure that we're clear, so we're strictly talking about simple microneedling, either using a derma roller, stamp, or a pen with disposable cartridges. We are not talking about microneedling with radio frequency, because that's something very different from a regular microneedling. Um, different in a sense that the micro needling with radio frequency is very potent. So one micro needling session, which is combined with radio frequency, equals to 100 regular micro needling sessions, which is amazing, but the risk involved are also a lot greater. So if right settings are not used for the radio frequency, they can cause post-inflammatory hyperpigmentation. It can also cause melting of the fat pads in the places where you don't want to lose the fat pads. So for at-home microneedling, again, you have two options for devices. You have derma rollers and stamps. I'll put them in one category, and then you have your pens. So for me personally, I use stamping only for my scalp. With 50 pounds weight loss, I saw a great hair loss, and that's when I started using this Revive hair mask. So I just stamp, and I do that like once twice a week. I stamp the area which is showing a hair loss, and then I just put a serum on it. I also alternate this with like minoxidil, so that's just Rogaine. And now for the derma roller, I have a derma roller and I use it for like rest of my body. So I'm trying to just experiment with my scar. I have a lot of scarring on my tummy. So I had two pregnancies, and then after that it just and it's genetic. This is just the experiment I'm doing. I mean, I'm not too overly obsessed with, I mean, it is what it is, but I just want to see if microneedling will show any positive results for scars that are decades old. Now, if you choose to derma roll your face, please make sure again your device is thoroughly disinfected and cleaned before and after the use. Also make sure that the needles are not blunt. So you can get like 15 to 20 uses from this, and then you just have to trash them and get a new one. For the micro needling pen, you have one-time use disposable cartridges that that I've talked about before, that you throw away after every use. So again, it kind of takes care of the first level of hygiene. You don't have to worry about disinfecting the needles. When you are attaching the needle to the pen, you just have to make sure that you're not touching the area where the needles are. And when you're done, you just throw it away in the trash. The pros for microneedling is that they can smooth out acne scar. It helps reduces the look of large pores. It helps your skincare product absorb better. It improves skin firmness and elasticity. It can fade hyperpigmentation if done correctly. Remember, skin of color is very prone to pigmentation. So it is important to get your first microneedling session done with a specialist who specializes in treating skin of color. For skin types 3 and higher, and I'm talking about Fitzpatrick skin typing scale, micro needling can be a double-edged sword. It can give you all those wonderful benefits that we just talked about, but if you are not careful, it can stimulate melanocytes. So most of the dermatologists you talk to, they do not like at-home microneedling, and I don't blame them, because probably they have to treat all the cases that is micro needling gone wrong, because people not taking the precautions, and that is resulting in different kind of infections. But again, if this is done right, I think it's one of the best procedures that you can do for yourself. Now let's be real. So if you go to a doctor's office or to the specialist, it costs $300 to $400. And if you're trying to do this on a monthly basis, it is just not feasible for like some of us. So I believe when again you have done your due diligence and you have taken the time to do your first session with a specialist and learn everything about the procedure, it can be easily done at home. I mean, I think we are incredibly smart group of women. We can figure this out. So again, I want to go over some of the problems. It's not one and done deal. You have to do this on continuous basis, because your skin doesn't stop aging. You're still aging every day. So you have to do it periodically, and you choose your own frequency. You can once every month, once every 2 months. Now it's recommended you do not do it more frequently than one session every 4 weeks. You have to let your skin respond and produce the collagen, because if you keep interrupting the process that you started and you start microneedling again while your skin is in process of building collagen from the session before, that can cause all kind of problems. So give your skin, once you're done with the session, give your skin a break, take 4 to 6 weeks off, and then you come back and do that again. Things that you should not combine with microneedling is like avoid aggressive treatment. So do not mix like strong acids, like any hydroxy acids with that. Now, to reduce the risk of pigmentation, you can pre-treat your skin 2 to 3 weeks before your microneedling session. And now, for the skin of color people like us, I recommend that we should use some actives that are kind of suppressing the pigmentation process on a regular basis. But if you don't want to use that on daily basis, you can absolutely use it a couple of weeks before your microneedling session. And those actives would be like alpha-arbutin, kojic acid, licorice root, tranexamic acid, niacinamide. Now, these are just a few active. There are like so much out there. So again, these ingredients will calm your pigment producing cells, which are the melanocytes, so they don't overreact to microneedling. Post microneedling care. So wash with gentle cleanser. Don't scrub. No harsh actives. As your skin barrier has been compromised, you are at the risk of transdermal water loss. So seal the surface with healing ointments like Vaseline. You can use red light therapy to expedite the healing. Try not to touch your face or neck on the day of procedure, and wearing sunscreen is a non-negotiable. Microneedling, somebody told me microneedling is like a date with your skin. So you want to prep, show up hydrated, and you do not ghost it afterwards. I thought it was like hilarious, and I think it's true. So is microneedling worth it? Yes, with the right care. So here's a demonstration that I filmed yesterday. If you have any questions, please drop them in the comment section, and I promise I'll answer. So before I end this, I just want to get closer and show you. So I did the micro needling session yesterday. I don't know if you can see my skin. So I'm wearing tinted sunscreen. That's all I'm wearing. I'm not wearing any foundation or concealer. So I think most of the pigmentation is gone. When I woke up, I saw some redness just close to my hairline, and there was some redness on my neck, but I see it's gone now. So, all right, take care. Bye bye. Hello. So I have decided to film my monthly microneedling session. Um, so today I'm gonna go deep. I am going to do 0.75 millimeter on my forehead, near my eyes, and I'm gonna do 1.5 millimeter on my cheek. I might go even higher. Um, Now these settings are just for me. I've been doing this for a while, so I have a good skin density. My skin is pretty thick, and you'll see. I mean, I don't even get a pinpoint bleeding. So if this is your first time, I'll suggest you go to a specialist and get this done over there. So you can see what equipment they're using, how they are keeping everything sterile, and most importantly, how your skin is reacting to it, and what it takes to take care of your skin. Post microneedling. So that's a good idea, and that's what I did. My first session was in a doctor's office where I asked a bunch of questions. They started, I think, at 0.25, and then they slowly kind of went up. Even back then, they told me my skin is pretty thick, so I think they use zero point 0.5 on my forehead, and then pretty close to 1 millimeter on my cheek area. And then they taught me what to do for my post microneedling care. So basically, you have to make sure that your skin is clean, you're not touching it or anything. So I remember applying sunscreen. Once we were done with the session, I came home, I washed my face, and after that, they had given me a mask, and that mask was just soaked in sterile water. There's nothing. So you are trying to minimize the transdermal loss of water. So that's why it's a good idea to just wear a mask where you can keep things nice and moist plus clean. And then at nighttime, I remember just using like a Vaseline. I just slathered a Vaseline all over and then went to bed. And the next morning, I feel like 70% had already healed. I mean, I have some redness, and by the evening time next day, everything was fine. So this is the doctor pen that I'm using. I'm using 16 needle cartridge. And what else? So this is the numbing cream that I've used. It's Numb 20. I got it from Amazon. So I had already done that. I applied it for, I believe they call it Numb 20 because you leave it on for 20 minutes. I left it for maybe 10-15 minutes. So I use it when I go above 1.5 millimeter. Now I can go ahead and not use this, but it just gets too spicy, and I feel like there's no need to suffer. Let's just use this. You just have to make sure that once you are done numbing, you go ahead and thoroughly clean your face. So my face is completely clean. So you should not be microneedling the numbing cream on your face. So besides that, I have my alcohol wipes. So I'm gonna go ahead and do one wipe on my face before I start, and then I spray down my working area, everything using the isopropyl alcohol 70%. This is very important. So you have to make sure that everything is clean. I have clean hands. I usually don't wear gloves. Sometimes it gives you a false sense of cleanliness. I mean, I know where my hands been. So once I clean it, I'm very careful about touching only the clean supply. So I have wiped everything down, including my Dr. pen. All right, so we can get started. So there are two ways you can microneedle. You can do a stamping motion, which a lot of people like to do. It just takes a little bit longer. Or you can do the slide motion. So for that, in order to slide the pen on your face, you need something to create a slip. I use this Baha or hyaluronic acid serum. It does the job. So I'm going to go ahead and apply it on the first half of my face. Because if I apply everywhere, it's going to just dry up. So. Okay, so I have attached the cartridge. Make sure that when you open it, you're not touching the needle area. The needle area is covered with this cap. So you take it off, and you can see the needles, and you do not touch that. And that needs to stay sterile. So I'm gonna go ahead and set it to. I'm gonna start with this area. So let's start with 1.5. So the other thing that you can set this pen to is like how fast the needles are moving. The slower they move, the deeper, the higher impact they cause. You can go, I think, all the way up to 6. I like 2. So I'm going to start with 2. So I already have a slip on. So I'm going to, I usually go vertical, horizontal, and then diagonal. Okay, so. And if you have an active blemish, try to avoid that. Like I have it right now, so I'm going to try to avoid it completely and go around it. You can see I'm starting to flush. It means it's doing its job. Keep on going. Make sure you're not missing any spots. Go ahead and put some serum to keep it slippery. When it starts getting dry, you can feel it start dragging your skin, and you don't want that. Okay. So this is the closest I'm going to go to my eye area. And there's something that I do at the end I'll show you. So it's important that you go cover all the edges. That's very important. Okay, so we're doing horizontally. I have a lot of texture issues on my lips. That's why I got a lot of acne when I was a teenager. Microneedling has helped a lot. It's maybe improved, I'll say 20 to 30% improvement. So I make sure I always cover this area. I'm gonna go diagonally. I'm gonna put some on the other side. I'm keeping my one hand right here. I'm making sure I'm not touching anything because that's the hand that I'm using to get the hyaluronic acid and rub it whenever my skin is getting dry. So I'm just waiting it. This side is taking a while to kind of get red. It's called erythema, the redness, and that indicates a successful microneedling session. Okay. I'm gonna do vertical, making sure I'm doing the edges. That's the part that people forget all the time. I think it's the most important part. Like I said, it anchors your face. So you have to make sure that it has a good collagen production going on. Because if that sags, everything else sags. And I can tell that, since I did not numb for 20 minutes, it's not completely numb, so I can feel it, but it's bearable, See, if you don't see erythema in a place, that means that that place was skipped, so you can go back and cover that area. Okay, this is my last pass. on my cheek area. Not a cheek, it's basically my entire face except for my forehead. What I'm gonna take a clean paper towel and I'm gonna just do this. I'm gonna bring that skin a little bit. I'm gonna pull the skin a little lower because I cannot go past that orbital bone. It's important that you cover this area. And I'm just gonna do one pass. Right, this. I'm gonna drag this over. I'm sorry, it looks so bad, but I want to give it all to you guys. I want to not do something because it's just not looking good at the camera. Because what's the point? We do so much gatekeeping, I feel like, especially in our community. I don't know why people don't share. Like, if they're doing something good, if they have done something good for themselves and they know it's working, share. Let people know. I mean, why not? Why? I don't understand. I've never understood this. It makes me feel sad, really sad. And that's why I decided that, whatever experiences I had in the past 2 years regarding, me going through perimenopause, having all these health issues, having to have urgent hysterectomy and all the things that I discovered in the process and came out swinging at the end. I never felt better in my life. I feel strong. So much energy. Never been, this fit in my life. And this all happened when people told me, okay, this is it. This is pretty much downhill. I mean, they didn't use exact word, but that was the sentiment. Like, you're gonna get used to it. No, I'm not gonna get used to it. That's also, it's my personality. When somebody tells me that there's something that I cannot do, or they tell me that, okay, I have to bring this down. I forgot to bring this down. So that's why I'm like, oh, let me. Okay. 0.75. If somebody tells me that I cannot do something, it can activate something inside me. I'm like, what did you say? And then I make sure that I prove them wrong. It has to be some kind of childhood trauma, I'm pretty sure. But I think something like that happened where, with all this weight gain and, just looking so bad. I even shared the picture in my last video. My family member is not happy. Well, I'll tell you, that family member is my mom. She's not happy about, that picture. But like I said, I want to be completely transparent. Completely. If something worked, I'll tell you. Something is not working, I'll share that with you guys. Okay, so, speaking of sharing, so 2 weeks ago I did a video about Botox and all the other fillers, and I was telling you guys that how you should be very careful when you are using neurotoxin in your upper face, especially the forehead area, because the whole thing can drop. Well, guess what? I had a session like last week where me and my injector decided to go ahead and inject right underneath that eyebrow, because like I said, I have an uneven eyebrow situation. So we did that, and after a week my eye dropped. She freaked out because this has never happened with her, even though she's extremely experienced. I was kind of, I was like, yeah, okay, things like that happen. When we do these things, there's always a risk of things going sideways. So you have to keep that in mind. That was a good reminder to kind of, take things easy, and a reminder of also not taking yourself that serious all the time. So I, when I informed her, like I said, she freaked out. She was extremely apologetic. I told her, what, it's she did what we together decided. And I honestly, I don't remember because she asked if I had rubbed my eye or if I massaged anything. I told her I remember being very careful that day, not touching my face, but who knows, maybe I did something, maybe the way I slept, because this is cyber sleep. So something happened where the neurotoxin leaked and went to this lower or upper part of my eye, and you can completely tell that there's a droop. And in my last video, that droop is pretty visible. But it's not gonna stop me from doing anything. I'm still gonna go to work. I'm still gonna film my videos. I'm still gonna drop my kids whenever they need to be dropped off. I have 2 teenage daughters, by the way, and I'm still gonna go socialize where, so it's not gonna stop. And if somebody's gonna ask me, I'm gonna tell them what happened. So to me, it's like a learning opportunity. Next time, I'm not even gonna go close to that area, and we'll figure something else out for my eyebrow problem. Okay, I'm gonna go ahead and do my neck. I'm gonna start with 0.75 and see if I need to go down to 0.5. I forgot what setting I used last time, but this I can't even feel this. You wanna cover your jawline. Cover your jawline. No, this one is not pink at all, so I'm gonna go ahead and. I'm gonna be a tiny bit aggressive where my turkey neck situation is. Wow, okay, so my neck, I think it's pretty numb. This I don't feel anything. Well, yes, 100%. Because you could feel it, I remember. Your skin in your neck is very thin. So, and it's so much more sensitive than your facial skin. See, there's no numbing cream right here, so I can tell that it's where I am. It's okay. This is all part of self-care. When you make these changes in your life, like real changes, like when you change your eating habits, when you start exercising, and not just for vanity purposes, just to become stronger or to overcome an illness. In my case, I had a surgery, so I just wanted to, come back stronger. And then you see, this huge improvement that you just made, either in your skin or in your body. It's just an amazing feeling. I mean, maybe it's been such a long time since I saw any that kind of transformation in myself. Like I said, my entire last 2 decades was spent, raising kids, building house, working on my career, going back to school, getting my doctorate. That's all I did. I just did not take care of myself at all. And when I made these little changes, oh my God, I was just blown away by and that kept me going. I was like, okay, so like, people saying that, mid 40s, this is expected. I was like, no. All right. So I can see I'm sorry, I'm still hitting the mic. I don't know. I made a list of things to go over before I film so I can remember. This is all still pretty new to me, and I'm learning every day. My promise to myself is that I am going to at least improve 0.5 to 1%, like every time I show up for you guys. And I don't know if you can see those improvements, but please know that I'm really trying to bring value to, like, whatever I've learned, just bring it all out for you guys, and be some kind of a service to the people of my community, to beautiful ladies of my community. Okay, so I'm gonna go ahead. So I'm looking in my mirror right here. I'm seeing if I've missed any spot. I think it's pretty nice and even. The erythema, my neck, I think there's a spot right here in the middle. Just gonna go ahead and so one more thing, so by this time the needles have gone blunt too, so I should not be doing more of this anyways. I'm almost done, so I'm gonna go ahead. So I'm so mentally used to not avoid this thyroid area because, whenever I'm doing microcurrent or I'm doing the RF radio frequency devices, my brain is trained to leave this area. I think I just did the same thing with microneedling. Microneedling, you can go ahead and do that. You don't have to skip the area. When you're doing red light therapy, you don't have to skip. I mean, it can go over where your thyroid is. It doesn't have any side effects. I'm done. I don't know. I was just looking at you can see all the gooey stuff. It's gonna go in the trash. All right. This is it. So what I'm gonna do, I'm just gonna go in the shower. I'm just gonna wash it with the cold water, and then I'm just going to put some mask on. Oh, one thing I forgot. So once you're done, you have 20 minutes. Before your pore closes. So what you can do, you can use any serum. Try to avoid exosomal and growth factors because, God forbid, if you have some precancer cell growing in there, that can kind of stimulate their growth. So we don't want to do that. So, but anything else like peptides, feel free to use. I did buy this. It's like some Korean companies. It says serum ampoule, salmon DNA. That's all it says. Antioxidant, rejuvenating, and revitalizing. It's from Brune Beauty. Let me actually just do it in front of you guys. So it comes with this bottle. So I've used it in the syringe. So you take this cap off, and then what you do. Okay, so you don't. That's a lot. So, and now you can go ahead and apply this. Apply this here. Things. I see some pinpoint bleeding over here. So whenever it happens on face, for me it doesn't happen, and I don't want to go above 1.7 millimeter at my home. So if it does, you just go ahead making sure that your hands are clean. You just spread it all over because it has the same factors when you do your PRP, PRF. So it has all these goodies that you can just spread all over your face, and then let it sit, and then just wash it off. So I'm trying to use all of it that's in the syringe. I took a lot of it out. Okay, I'm gonna just squirt it back in because I just pushed all of it in. I don't need it that much. Okay, I'm just gonna let it sit for. Actually, I'm gonna go ahead and eat dinner. My husband is waiting. He cooked egg fried rice. I think he made egg fried rice, and he was saying he will make some shawarma because we have a leftover rotisserie chicken. So, all right, I'll see you later. Bye.